Good morning. Hi. Is this on?
Yes, it is.
It is on. Good morning. It's on now. Thank you. Good morning, everyone. Welcome. We appreciate you coming out in the rain to join us in your kayaks. I'm going to make a few announcements, and the ceremony will begin in just a few minutes. In the event of an emergency, please walk to the nearest exit. They're all around you, and there's also some on the ground floor behind me here. Please stay up there. It gets a little congested down here, and there'll be plenty of opportunity for pictures. Please hold your applause until all names are called. Please turn off or silence your cell phones. And we'll be hosting a reception immediately afterwards at the School of Public Health. This is our chance to meet you, and we would love to meet all of you. So if you would go over to the School of Public Health, it's just outside the building, and over the stream in your kayaks. Thank you so much. The ceremony will begin in just a moment. Please be seated. Welcome, everyone. Thank you for joining us on this very special occasion. And thank you for pulling yourselves away from the royal wedding and all the hats. We appreciate your presence here. They have the hats, we have the heart. It's my pleasure to introduce Dr. Boris Lushniak, Dean of the School of Public Health, who will preside over today's ceremony. We are most fortunate to have such a passionate public health leader who came to us after more than 27 years with the United States Public Health Service, including roles as Deputy and Acting Surgeon General during the Obama administration. He is a man on the move, both figuratively and literally. He climbs mountains, races cars, jumps out of airplanes, and runs marathons. Most importantly, he embraces life's journey and takes every opportunity to solve public health issues at the local, national, and global scale. He is an inspiration to our students, staff, and faculty, and we would all do well to emulate him to make the world a better place. Please welcome Dean Boris Lushniak.
Thank you so much, Coke, and thank you for that kind introduction. So this is my second May graduation. So it's been an outstanding year and a half. I know we barely got to know each other, graduates, in this year and a half, but I'm here to shout out not only that congratulations to you all and to your family members, but that sense of reminding you of the importance of this event. Now in England right now at this very time, people are dressed up in funny clothes as well. They walk down an aisle as well. They had funny things on their heads. And the world is watching there. But I really want to focus on the world watching here, because your mission in public health, to do good for the world, to fearlessly do good for the world, is of such utmost importance that the ceremony in England pales in comparison to what goes on today. Because today you're allowed to add several initials to your last name, right? Whether it's a bachelor's initial, a master's, or a doctorate initial. The key is, beyond those three letters are the responsibilities that come with those three letters, to be able to focus on people around us. On behalf of all the faculty and staff, I'm pleased to welcome the families and friends of our graduates to the School of Public Health Spring 2018 Commencement Ceremony. And again, to the graduates, a hearty congratulations. Let's hear a cheer for the graduates right now. Come on. In addition to our faculty seated on the stage today and in the crowd as well, I'd like to take a brief moment to introduce a few special guests who have joined us. Good friend of mine, Rear Admiral Sylvia Trent-Adams, the Deputy Surgeon General of the United States, who will deliver the commencement address, and Samia Ahmed, the class of 2018 undergraduate student speaker. Thank you so much for being here. At this time, I'd also like to introduce and welcome our chaplain, Mr. Robert Snyder, who will lead us in a moment of reflection with the invocation. The university chaplains represent many cultures and faiths and work collectively to serve the spiritual needs of the University of Maryland. Chaplain Snyder represents the Christian Science Campus Ministry. We eagerly await your words, Chaplain.
Let us pray. Let us reflect. Today, we are gathered together for this commencement celebration. And we ask of you, O great and everlasting universal love, truth, spirit, to grant us wisdom, intelligence, integrity, love, creativity, and humility as we leave here today and make our way in our professions. And please watch over us and protect us and lead us on a path successful in meaningful service to humanity. unfolding to us only good ideas, prosperity, and accomplishment. Amen.
Thank you, Chaplain Snyder, for these words, but also for your voluntary service to the university, for joining us today to commemorate this milestone in the lives of our graduates and their families, and for so eloquently putting this day into context, reminding us of the importance of embracing and being fully present in each and every moment, today and every day. And now I'm pleased to introduce Samia Ahmed, who is earning a double degree, not one, but two, in public health science today and on Monday from CNMS in physiology and neurobiology. She was chosen to represent our graduating seniors. Ms. Ahmed spent her 4 undergraduate years taking credit overloads to earn her dual degrees and to graduate from the university's Integrated Life Sciences Honors Program. She was an alternate breaks trip leader, which included leading a group of UMD students on a trip to Nashville, Tennessee to work with immigrant rights organizations and to learn about the complexities of life for the diverse immigrants and refugees who have settled there. You can read more about her impressive academic and service activities in the program. I wish Ms. Ahmed great success in her future pursuits and as she applies to the healthcare profession that she chooses. Thank you so much for being here. Let's make sure it's here. Perfect.
All right. Well, good morning, everyone. I'd like to begin with a little disclaimer. It is Ramadan and I am fasting, so if my voice cracks at any point, I apologize in advance. Thank you, Dean Lushniak, faculty, staff, my fellow graduates, all of the loving and supporting family and friends in the crowd. There are so many qualified individuals in this room that I am extremely honored and humbled to have been given the opportunity to speak to you all today. My fellow graduates, we have worked hard to put ourselves here today. Countless sleepless nights in McKeldin, triple booking our schedules, working on or off-campus jobs, taking credit overloads, and worst of all, sitting for hours in peak traffic, only to fight to the death for the last parking spot, or walk miles upon miles to every class, because let's be honest, SPH gets further and further away from the rest of campus each day of the semester. Whatever the challenge, I guarantee you, someone in this room has faced it and met it. But honestly, I'm not here today to talk about how hard we have worked. I'm here today to remind us why. As we go out into the real world, we will likely burn out. We will be tired and drained at times. You see, life is not a straightforward course. There are sharp turns and bumps we will never foresee. That is why it is so vital we revisit who we are as people and reevaluate what our passion, our mission in graduating from the School of Public Health is. When we look back at our academic careers, we will vaguely remember the stressful days, the exam scores, and of course, the pinnacles of our success, our GPAs. But I assure you what we will remember most is our experiences and the people we met along the way. I personally will never forget the woman who came into a free health clinic during an alternative break trip in South Carolina. She had no idea her systolic blood pressure was measuring 300, whereas the standard is 120. I will never forget Nathan, a man who found himself homeless in DC after consciously leaving a wealth-filled life of selling drugs, who taught me that not all money is good money. I will never forget one child, insecure about his appearance, who asked me why he was bigger than the other kids or why he wasn't as pale-skinned as the rest of his family. I will never forget the cries of agony in the hospital as patients waited for hours for imaging results to return, or the cries of a woman abused by her partner who in that moment needed her gynecologist to be more her friend than her physician. Lastly, I will never forget the Syrian refugee family that I had the privilege of having dinner with, who could not visit the dentist because of a lack of transportation. The son, then 10 years old, was being bullied at school, yet he still greeted me with a smile. The father, stressed by the pressures of being in a foreign nation, was so ecstatic by me speaking one word of Arabic, a simple afwan, or you're welcome, in response to his thank you. And one more thing, that was not the last point. And lastly, I will never forget all of the hardships faced by the family and friends who have pushed me here today. These individuals shaped my passions. They shaped my desire to serve. They taught me that health and living life has a different meaning to everyone. Each and every one of us as has individuals in our lives who have influenced why we are sitting in this room today. It is these people who teach us that there are so many issues in this world that impact health. With the public health mindset, whether you become a physician, a health administrator, a family counselor, an epidemiologist, or a personal trainer, it becomes a service for the people who have shaped our lives. You do it because you want to give back. You do it because healthcare should not be a privilege. You do it for equity and opportunity. You do it because making a difference in just one person's life can have infinite value. Most importantly, because you do it because you have been blessed with a heart that cares. Remember these things because, as I said earlier, we will strive for success, but sometimes we will fall short in unexpected, unaccountable ways. Admiral William H. McRiven, in an address to UT Austin, once said, "To be successful, make your bed each morning. It is one simple action that will make you feel productive for the rest of the day, and even when nothing has gone right that day, you will go home to at least one success. However, when life hits you hard, that one success just isn't enough. In those moments, remember, as Mufasa once said, remember who you are. Remember your experiences, remember what motivates you, remember who motivates you. Remember why you have worked to be here today, and use that to push you forward on dark days." On that final note, on behalf of the class of 2018, thank you to the University of Maryland and all of the individuals who have given us a reason to be here today. Congratulations, everyone. We made it. Thank you.
Thank you, Samia. I would now like to introduce the president of our School of Public Health Alumni Network. So that's the other transition that takes place. Soon we're going to go through a ceremony where you're allowed to change your tassel from one side to the other. That's a symbolism of your metamorphosis to being graduates. There's also another metamorphosis that occurs, is you should have an allegiance to the University of Maryland, to the School of Public Health. And one way to continue that activism is through our alumni network. I'd like to introduce Dr. Alyssa Todaro-Brooks, who is the president of our School of Public Health Alumni Network, to say a few words and to welcome our soon-to-be graduates to that network.
Thank you, Dean Lushniak. First of all, I offer a heartfelt congratulations to each and every one of you. I have been so inspired personally by your academic achievement, your persistence, your energy, and your commitment to public service. So today is about celebrating your accomplishments and everything that you've contributed thus far as students. But this is just the beginning. There is absolutely no doubt in my mind that each of you can and will change our world for the better, regardless of the path you choose. So allow me to be the first to invite you to the Alumni Association and the School of Public Health Alumni Network, your future colleagues. Our mission is to build commitment through social, professional development, and educational opportunities. Your education here will open doors for you, so please know that our door is open for you as well. Get involved. Ask how you can help with communication and outreach, or represent your university as a public servant in your community. Ask me how, or you can find information in each of your packets. You have fearlessly promoted health for all as a student, so now we and I implore you to stay fearless. Bring us your ideas, your energy, and most importantly, your passion for public health. Thank you, and go Terps.
It is now my great pleasure to introduce our commencement speaker today. Rear Admiral Sylvia Trent-Adams. As Deputy Surgeon General of the United States, Admiral Sylvia Trent-Adams advises and supports the Surgeon General regarding operations of the U.S. Public Health Service Commission Corps and in communicating the best available scientific information to advance the health of the nation. She and I share the experience of wearing the uniform of the U.S. Public Health Service. We are both among those privileged to have served in the office of the U.S. Surgeon General. In fact, now, after today's commencement speech, she and I will have shared something else, which is 3 years ago, I was the commencement speaker at this very event. So I was warning her that you don't know what the future holds, nor do you know the impact of today's speech, right? We may come a-looking in the next few years as you decide that it's time to transition. Not that I'm encouraging that, because she's doing such a great job as the Deputy Surgeon General. It is a great honor to have served with someone with such a breadth of experience who truly understands the front lines of public health, and to have her here with us today. While she officially isn't a TERP, nor am I, I'm one who have come into this TERP world in the last year and a half, as I mentioned, but she, however, has 2 degrees from the University System of Maryland Schools, a master's in nursing and health policy from the University of Maryland School of Nursing in Baltimore, and her doctorate from UMBC. I think we can make her an honorary public health TERP today. Ladies and gentlemen, please welcome the Deputy Surgeon General of the United States, Rear Admiral Sylvia Trent-Adams.
Good morning, everyone.
Good morning.
Thank you, Dean Lushniak, for that warm welcome. And I want to say congratulations to the graduates, and thank you to the family and friends who are here to support our graduates and all that you've done. A special thank you to the faculty and the staff who have supported you on this journey. This is truly a wonderful day. Many of you probably had questions whether or not you'd actually get to today. At least that's how I felt when I started my graduate program. But as they say, you never know what life has in store. You know, when I was asked to come and speak today, and I talked to the staff as this invitation rolled in, I said, you know, this is a busy time. We have a lot of commencements going on this time of year, and it's an honor to have the opportunity to speak to graduates, because you can have the opportunity to share with them some horror stories, some encouragement, and hopefully provide a little bit of guidance on how to avoid some of the pitfalls that we may have encountered. But when I thought about the person who was on the other end of the invitation, your dean, my friend, Admiral Lushniak, I stopped for a moment and said, to spend the morning with Boris Lushniak, what does that mean? It means that I would have the opportunity to sit beside a colleague, a friend, and someone that I truly admire. I want to thank him for the opportunity to be here, because he has made such a significant impact on public health and health for the world, that leadership is going to continue on in the work that you do. So, sir, thank you. Today, as you walk across the stage, it's truly a new beginning for many of you. Throughout the last several years, you've been working hard. You've made it through the exams, the papers, and the deadlines, the traffic, and everything else to get to this day. So today I want you to take a moment, take a deep breath, literally take a deep breath. Where are my kinesiologists? Deep breaths are good. Now, you're going to go through a transition this morning. You're going to move that tassel from one side to the other. And the other one is that you're going to begin your journey into a new phase of life. You're now going to join a special group of healthcare providers, healthcare professionals, healthcare leaders, public health experts. You're now and forevermore, I deem you public health warriors. The future of the health of our nation and our global community is in your hands. As public health professionals, you have the ability to create a system of prevention and education, health and health care that will have an opportunity to impact every one of our communities across the United States as well as in the world. Currently in the United States, we don't have a health care system. We have a sick care system. We treat chronic illnesses. You are now equipped with the tools to change our culture from one of sick care to one of health. I hope that you will not take the back seat, that you will be out in front, trailing along through many, many communities that are underserved, blazing, if you will, a new trail for others to follow, because you can make a difference, and you will make an impact on some of the people that you will never see. One of the things that I've learned throughout my career is that it doesn't matter who knows what you did. What matters is that you're fulfilled with the mission that you accept in your day-to-day profession, and more importantly, that you feel connected to the people and the mission that you serve. Much of what you do will not be noticed. It will not be on CNN tonight. It may not make it to the front page of the Washington Post. But nonetheless, understand that what you do will affect the lives of everyone around you. And do not let anyone convince you that you cannot affect change. By choosing to pursue a career in public health, you're already well positioned to implement a series of changes. You are, by definition, game changers by virtue of your desire to help others. As a graduate of the University of Maryland system, I know firsthand you can affect change locally and even globally. You have the skills and knowledge to empower others to see themselves as they can be, not as where they may be. You can help them to understand that they can be healthy, that there is hope, and that they can thrive, and they can have a better life. You can better inform them of what health really means to them and their community. Your ideas can be the spark to create an innovative approach to prevention, delivery system reform, or new therapies and treatment for emerging infections. If you have an idea, pursue it. You never know when your idea may lead to a cure to what we now consider a chronic disease or an incurable disease. We can create better ways to approach public health in the communities and in the clinical settings. I've always had an interest in healthcare, and sometimes I tell people that when I was 12 years old, I knew what I wanted to do when I grow up. That was a long time ago. I thought I would say that I started when I was 2. But actually, the one thing that motivated me was the ability to help others. And many of you may share that passion. But during my time as a clinician, I enjoyed helping others. But I enjoyed being able to affect change in the delivery system more than anything else, because I learned as a clinician that even though I could be effective at the bedside, I needed to better understand how healthcare really worked. And this led me to pursue formal training in policy and also to learn how to effect change at the local and the national level. So as I was interning in the United States Senate and I pursued my policy doctorate, I began to understand that there are so many opportunities for all of us to effect change. I now understand that policy affects every aspect of our lives. Everything that you do from a clinical perspective, prevention perspective, or the way that you interact with communities and patients is somehow governed by policy. My career as a nurse began, like I said, just a few years ago, in the early days of the HIV/AIDS epidemic. I cared for patients living with HIV and AIDS, some of them at the very end of their lives. I began to understand how stigma, social isolation, and discrimination could be the norm if no one wanted to make a difference. It was very challenging for patients, but even more so, in some ways, for the provider community. At that time, we didn't have a lot to offer in the way of care and treatment, but we did everything we could to make sure that we treated our patients with dignity and respect. We learned to meet people where they were and to allow them to teach us about their needs. We can build the best state-of-the-art system for prevention, surveillance, and treatment, but the programs we develop and implement do not meet the needs of those we serve. It is all built in vain. When I think back on the early days of the HIV epidemic, and even those that we faced in the Ebola outbreak, those experiences laid the foundation for a career dedicated to public health and assisting others where they are. It helped us to understand, helped me to carve out a place for me in public health that allowed me to care for those who needed me the most. I had to understand that building systems of care required that I not understand just my perspective, but I would allow myself to open my mind and my heart to the needs of others. This is my passion, and those experiences helped me to get to where I am today. And I share this with you to show you that you never know where the journey is going to take you. I never thought in nursing school that I'd end up being the Deputy Surgeon General, or that I'd have the opportunity to travel across the world to do interesting, sometimes crazy things. But every twist and turn of my career has provided me with some level of experience and insight into what's possible. In a lot of ways, it allowed me the chance to make a difference. And I too hope that you will share some of those similar types of experiences, because you too will make a difference. Make each one of the opportunities that you face, make it count. Because along this journey, I have learned that some things are never as they seem. And what I want to share with you today is this: Rome was not built in a day. Don't expect to change the world or the healthcare delivery system overnight. But if you stay on course, if you stay true to your mission, you can make a difference. And that large rock, that piece of granite in the middle of the room, can be shaped, molded, and carved into a beautiful statue, one that can represent change and affect all those things that you want to see within the healthcare delivery system and in public health. Never forget where you came from or how you got there. And don't forget the people that helped you along the journey. The individuals who supported you along your journey will continue to support you. The experiences that you encounter now and in the future will give you insight into not only who you are, but what you're capable of. Without the people that are around you to support you, you would not be who you are. So as you walk across the stage today, just stop and think for a moment. It's time to say thank you. It is also time for you to understand how to give back to those who may be coming behind you. It's often said that your greatest successes will become your greatest failures, will come from your greatest failures. Never be afraid to fail. There are only two things in life that are true. One, change is real. Secondly, the only thing constant in life is change. And all those things that you go through, whether it be through academia or in real life work experiences, those experiences will shape you, and it will shape your mind and give you new skills and tools to do even greater things. Take advantage of every opportunity. Throughout my career, I've been asked and sometimes told to take on jobs that I really didn't want, and sometimes nobody else wanted them. But I think I learned the most from those opportunities because it forced me to get outside of my safe zone. And I hope that you will stretch yourself and take on opportunities that you don't like or you don't think are relevant and be successful in them because they create an opportunity for you to grow, learn, and even move to the next level. I want to share with you a quote from Booker T. Washington, and he says, quote, "Success is to be measured not so much by the position that one has reached in life as by the obstacles which he has overcome." You will face many obstacles along the way. It is up to you to take the obstacles and turn them into opportunities. You cannot have a testimony without a test. Your knowledge is truly a gift. It is more powerful, it is most powerful when it is shared. Don't take your gifts for granted. Each one of you is unique, and you have a very special destiny to fulfill. I hope that you will chart your own course and do those things that only you can do. As you build your career, you will touch lives, you will impact those around you. Some, as I said before, you may never see, you may never know, but nonetheless, as a public health practitioner, as a public health expert, that is the essence of what we do. We help people even when they don't know they need to be helped. I want to thank you for the opportunity to be here to celebrate your success. You are the future of public health, and you have the power to change the world. I hope you will use it to do great things for the world. Congratulations and Godspeed.
Thank you, Rear Admiral Trent-Adams, for being part of this celebration, for sharing this important moment with our graduates and their families. Your public health experience and leadership is an inspiration to us all. On behalf of the School of Public Health, I'd like to thank you, and at some point we're going to get the gift to you that we had promised that was going to be here, but I think we ran into some technical difficulties. But it's coming. It's in the mail as we speak. Commencement is the day on which the school bestows our highest honors upon our students, the bachelor's degree, the master's degree, doctoral degrees. At this time, I ask that Dr. Coke Farmer join me as we begin the recognition of our School of Public Health degree recipients.
Will those receiving a doctoral or master's degree please rise? Dean Lushniak, in accordance with the recommendations of the faculty of the Graduate School, I present to you those students who have successfully completed all graduate requirements for the Doctor of Philosophy, Master of Arts, Master of Health Administration, Master of Public Health, and Master of Science degrees.
Thank you, Dr. Farmer. Dr. Farmer, I acknowledge the recommendations of the faculty of the Graduate School, and I'm pleased to extend my congratulations to each graduate for successfully completing all degree requirements. Will the Doctor of Philosophy and Master's degree recipients please proceed to the platform?
I would now like to introduce Dr. Stephen Roth, Associate Dean for Academic Affairs, who will present the recipients of the School of Public Health graduate degrees.
From the Department of Kinesiology, Dr. Kyle Jacobs. Go ahead. Dr. Jacobs' advisor is Dr. Bradley Hatfield. His dissertation, Self-Controlled Practice to Achieve Neural Engagement, an Underlying Brain Process to Enhance Cognitive Motor Learning. Receiving the PhD in Kinesiology, Dr. Bradley M. Ritland. Dr. Ritland's advisor is Dr. Bradley Hatfield. Dissertation, The Impact of Short-Term Sleep Extension on Cognitive and Motor Performance in College Tactical Athletes. Receiving a PhD in Behavioral and Community Health, Dr. Hannah Allen. Her advisor, Dr. Amelia Aria. Dissertation, Graduate Student Burnout and Attrition, Examining Associations with Substance Use, Mental Health Problems, and Academic Support. Receiving a PhD in Behavioral and Community Health, Dr. Elizabeth Seaman. Her advisor, Dr. Craig Fryer. Dissertation, Co-Occurring Marijuana and Tobacco Use Among Young Adults, a Sequential Explanatory Mixed Methods Study. Receiving a PhD in Behavioral and Community Health, Dr. Julia Sen Chen. Her advisors, Dr. Carrie Green and Dr. Dina Borzakowski. Dissertation, an investigation of the predictors and perceptions of flavored e-cigarette use and local flavored e-cigarette sales restrictions in the United States. Receiving a PhD in Behavioral and Community Health, Dr. Kathleen Shakira Washington. Advisor, Dr. Sharon Desmond. Dissertation, exploring the effects of adverse childhood experiences and social integration on adolescent suicidal ideation. Receiving her PhD in Family Science, Dr. Tawanda Street. Her advisor, Dr. Amy Lewin. Dissertation, influence of military and family life stressors on the readiness of male and female service members. Receiving her PhD in maternal and child health, Dr. Yasemin Vafai. Her advisor, Dr. Julia Steinberg. Dissertation, the effect of depression on women's contraceptive behaviors and teenage pregnancy. Receiving the PhD in Family Science, Dr. Jennifer Young. Her advisor, Dr. Norm Epstein. Dissertation, couples coping with Lee-Framani syndrome, a mixed method study of family strengths. Receiving the PhD in Behavioral and Community Health, Dr. Megan McHugh. Her advisor, Dr. Robert Gold. Dissertation, cyberbullying, an examination of victimization, parent-child communication, collective efficacy and safe behaviors online among young adolescents. Receiving the PhD in Epidemiology and Biostatistics, Dr. Rodman Turpin. Dr. Turpin's advisor, Dr. Tiffany Dyer. Dissertation, the syndemic effect of psychosocial and structural factors on HIV testing among Black men and the moderating effect of sexual identity. Receiving the PhD in Epidemiology, Dr. Xiaoxiao Liu. Advisor, Dr. Sunmin Lee. Dissertation, the health implications of stress among Chinese in China and among Asian Americans in the United States. And now, students receiving the Master of Public Health in Behavioral and Community Health, Molly McKinstry. Noura Kanfash. Rebecca Bailey. Anna Clayton. Amy Cohen. Mandy Kennedy. Colleen Howarth. Grace Fansler. Selene Tichuana Huardo. Bridget Higginbotham. Chanel O'Connor. Receiving the Master of Public Health and Biostatistics, Weibo Chen. Chunxing Liu. Receiving the Master of Public Health and Epidemiology, Chenyi Zhang. Morgan Williams. Alicia Ward. India James. Haley Marr. Alyssa Faust. Soo-Young Hong. Ami Fukunaga. Sarah Safai. Safi, apologies, Safi. Receiving the Master of Public Health and Physical Activity from the Department of Kinesiology, Ariel Ocampo. Receiving the Master of Arts in Kinesiology, Teresa Haig. Junyun Wan. Receiving the Master of Science in Couple and Family Therapy, Pamela Herrick. Leanne Sider. Jasmine Moss. Liza Harbison. Naomi Levine. Wilson Lorena. Natalie Krenz. Diamond Green. Jordan Madison. Rolanda Williams. Receiving the Master of Health Administration from the Department of Health Services Administration, Nigel Williams. Daniel Marthy. Nisha Dabaria. Sunjeev Krishna Ganesh. Nia Kulkarni. Afni Patel. Anna Simon. Vanessa Fuentes. Tony Wynn. Brenton Andrasic. Milad Marani. Alpheus A.K. Cisse. Sean Linman. Jonathan P. Rudy. Elizabeth Dunwitty. Pronounce your last name. Maria Nakwanzi. Ayana Jones. Yewande Akinquo. Taylor B. Rogers. Brianna D. Jones. Heather Witzak. Erica DeBadges. Dilany Gunwardine.
Congratulations again to the Doctor of Philosophy graduates and to our Masters of Arts, Master of Health Administration, Master of Public Health, and Master of Science recipients. Way to go, grad students, way to go.
Will those receiving the Bachelor of Science degree in Public Health Science please rise? Dr. Stephen Moore,
Dean Lushniak, in accordance with the recommendations of the Faculty of Public Health Science, I present to you those students who have completed all graduation requirements and are recipients of the Bachelor of Science degree.
Dr. Roth, I acknowledge the recommendations of your faculty, and I am pleased to extend my congratulations to each graduate. Coke, you're on. Will those receiving the Bachelor of Science degree from the Department of Family Science please, actually no, let's get through with these first.
Samiha Nahar Ahmed. Alexandria Brown. Wengel Gugsa. Samarawit Sebasibi. Maran Huninga. Samarit Gurma. Jerusalem Abibi. Amy Rosaria Cabrera. Karen Alice Weber. Elizabeth Severin Reese. Fiona Kennedy. Samantha Elise Green. Treya Shaw. Jess Elise Coggins. Maura Kathleen McCann. Samantha Caitlin Curbello. Mary Catherine Afzali. Brittany Brown. Megan Victoria Chu. Leah Fikru Asfau. Allison Rochelle Gaynor. Hannah Rachel Jerrison. Freddie Flores. William Henry Norris. Elizabeth Lopez Santiesteban. Stefania Velez Gomez. Simone Elizabeth Fleury. J.C. Lynn Hart. Bianca Margaret Fiore. Allison Kayla Kell. Joan Ashley Bilski. Rashay Paul Verma. Mirim Lee. Courtney Cheryl Dang. Mark Groom. Richard Song Lee. Stephanie Sujung Choi. Gabrielle Leah Brown. Samantha Erin Ernst. Emily Rose Siegel. Taylor Griffin. Julia Santoro. Madison Dana Camp. Lindsay Mara Gray. Carrie-Ann Rose Gibney. Catherine Patton. Sarah Abigail Stull. Matthew John Zawalik. Jonathan Ryan Alcazar. Mackenzie Thompson. Rochelle Gutierrez. Deanna Wedding. Melissa Rose Bartow. Ashley Harar. John Fitzgerald Swanton. Andrew James Quinn. Windu Lai. DeAndrea Wynn. Najee Miata Bandi. Rashida Balu Kamara. Anady Andrew. Sarah Saki. Monica Lily Eng. Elizabeth Darlene Walton. Amin Zachariah Khalil. Patrick Thomas Bjork. Maximo David Losada Radley. Jessica Podestivo. Haley Evelyn Bradley. Laura Corey. Lexi Corrine Glockner. Jacqueline May Ewing. Madison Grace Kutzera. Olivia Grace Durling. Kaylee Ann Kennelly. Ashley Renee Rumatuli. Claire Seaton Ford. Margaret Annabelle Lane. Cleve Ekby. Clayton Mycoom. Madeline Elaine Haggerty. Chatbudi Azanakobi. Gabriella Spencer. Crystal Wachuku. Drew Kiva Foster. Chelsea Sabrina Benjamin. Stacy Mbet Coombe. Augusta Teresa Noah. Rachel Ilana Davis. Katie Marie Vietz. Myra Alam. Arich Jendi. Yusar Tagori. Hira Rahman. Khadija Arif Alvi. Peyton Wade. Adeza Amuafile. Hannah Hengyong Kim. Elise Lee. Yasmin Hussein. Sadia Hassan. Najma Sahan. Jordan Salmon. Angela Yu. Nancy Nguyen. Ewan Bowie. Samjana Nupane. Mari Tukoyan. Danielle Malayam. Nicole Fallis. Charlotte Costello. Ilana Loster. Sarah Julie Benenson. Aliana Kahan. Marissa Rose Baxter. Jessica Taylor Quinn. Jory Parson. Jack Andrew Payne. Marcus Roosevelt Smith. Elise Lauren Abrams. Ifra Sod Ansari. Meghana Anadata. Priya Delsania. Shreya Delsania. Shivani Talwar. Rachel Cermak. Karen Wynn. Miriam Khan. Ajua Ofosu Ameya. Marcus Allen Fisher. Atasa Alamahudi. Anne Catherine Grela Mpoko. Vishal Chavan. Nanami Kamalishi. Dylon Nujen. Sorab Navai. Omid Bar. Samantha Julia Quinn. Eric William Wellham. River Brooke Williams. Payam Tavakoli. Samantha Ann McGeehan. Olivia Lee Mays. Casey Kwangin Chan. Natalie Stacy Reynolds. Shabria Gibbs. David Egbufoma. Usha Singh. Amory Y. Tete. Elizabeth Talalupe Segnule. Tiffany Avaniela Potranta. Ari Papadopoulos Flores. Preeta Rayamaji. Roshan Belbase. Michael David Flancia. Jasmine Simone Coltrane. Hawa Anthony. Alexandra Elizabeth Bean. Lynn Ma. Tangela Rahman. Fauzi Ashraf. Christina Asari. All right. Will those receiving a Bachelor of Science degree from the Department of Family Science please rise? Dr. Sandra Quinn, Department Chair, will present the degree recipients.
Dean Lushniak, in accordance with the recommendations of the faculty of the Department of Family Science, I present to you those students who have successfully completed all graduation requirements and are recipients of the Bachelor's of Science degree.
Thank you so much. Dr. Quinn, I acknowledge the recommendations of your faculty, and I am pleased to extend my congratulations to each graduate.
Teresa Rose Collier. Jesse Ray Woodall. Megan Christine Hemmer. Johan Malcolm. Michaela Caroline Epicella. Sherelle Sarah Altman. Caroline Joy Nugent. Afua Karama Awosu. Priya Beth Sharma. Rahel Maharatab. Emmanuel Enrique Saran. Jessica Lee Schoen. Alan Yin. Christine Maria Kraus. Leandro Marquez Manuel. Gabriella Hammer. Shanice Maria Asilis. Myra Allison Saavedra. Patricia Mezzarina. Sandali Chandradasa. Mary Caitlin Nicholas Dato. Stephanie Ruby Araniva. John Joseph Fellers Jr. Erin Nicole Sullivan. Ariel Masika. Jesse Anna Bonham. Melvin Kane. Gabriella Michelle Ellison. Uwatoni Onemoya. Roy Tiralda. Catherine Angela Trent. Alexandra Erin Kennedy. Stephanie Shao. Doreen Rosario. Amani Griffin. Ji Cha. Natalie Porta. Gertrude Fubi Nkwamu. Sorry. Chinamaram Akujobi. Morgan Rial Bristow. Zach Alexander Miller. Samantha Eileen Pavsner. Marissa Blair Robinson. Brianna Bachner. Erica Rainey Levy. Imana Abdulmalik. Hassan Sorkati. Micah Yarborough. Kariatu Binta Tunkara. Trey Reese Roberts. Alana Dorothea Shower. Bryce Andrew Kaitis. Anja Anier. Julia Cook Price. Lillian Baker. Oliver Sham Victorian Ajimoko. Michael Racino. Kevin Raphael Martier. Imani Lanice Johnson. Brooke Middleberg. Nicole Janoff. Shannon Burkheimer. Emma Haydaz. Elliot Watson. Nariko Katagiri. Zuliema Alvarado. Caitlin Mary McAllister. Astrid Putri Musfar. Dennis Samuel Amaya. Naya Simone Ferguson. Amber Booth. Melissa Angela Grace Lodge. Chelsea Sejo Shea. Deborah Chimdima Okir. Shakira Ayodeji. Anthony D. Coley. Rachel Thibault Dillon. Mehi Elsiad. Azalea Abigail Hernandez. Marche Crushon Jones. Archelia Jacqueline Johnston Taylor. Alicia Denise Bryant. Quanice Alexis Wooten. Jessica Maizana. Will those receiving the Bachelor of Science degree from the Department of Behavioral and Community Health please rise? Dr. Barbara Kerbo, Department Chair, will present the degree recipients.
Dean Lushniak, in accordance with the recommendations of the faculty of the Department of Behavioral and Community Health, I present to you those students who have successfully completed all the graduation requirements and are recipients of the Bachelor of Science degree.
Dr. Kerbo, I acknowledge the recommendations of your faculty, and I'm pleased to extend my congratulations to each graduate.
Katia Kaplow. Sofia Marmolejos. Nikita Daniel. Leah Mejia. Brent Cook. Brianna Lockhart. Sierra Michelle Bryant. Marina Beatrice Melina Haraguena. Mariana Jasmine Molina. Amelia Feng. Tequila Marie Gondega. Biola Upi. Boliwatufe Barakat Camille. Marie Nua. Samuel Hiley. Dylan Kirby. Benjamin Peter Harper. Nicholas Granazio. Nicole Messina. Merritt Rachel Dermer. Maya Lee Dean Poliak. Natalie Suzanne Fecto. Hannah Elbarai. Carla Alvarado Granados. Rachel Elizabeth Seitz. Molly Mantis. Jessica Nicole Goldstein. Raquel Leah Weinberg. Delaney Nicole Todd. Talia Nicole Hawk. Jessica Joanne Throw. Mary Elizabeth Lees. Emma Zenya Araxam. Dara Makesh Patel. Jacqueline Wilson. Sydney Love Rutledge. Tiffany Nicole Filomena. Victoria Valcarcel. Olivia K. Burgess. Joseph Louisi. Fiona Bett. Rebecca Sharatsky. Lauren Levy. Miriam Khan. Hania Javaheri. Sarah Shahid. Sabrina Nicole Pasta. Beth Sarah Goldberg. Sarah Margaret Fisher. Alexandra Noel Lafree. Thank you. Will those receiving the Bachelor of Science degree from the Department of Kinesiology please rise? Dr. Bradley Hatfield, Department Chair, will present the degree recipients.
Dean Lushniak, in accord with the recommendations of the faculty in the Department of Kinesiology, I present to you those students who successfully completed all graduation requirements and are recipients of the degree Bachelor of Science.
Dr. Hatfield, I acknowledge the recommendations of your faculty, and I'm pleased to extend my congratulations to each candidate.
How you doing over here? All right, good, good.
You're doing a great job.
Thank you, you too.
Spare voice.
You spare brain. Good morning. We're ready. All right. Daniel Sanchez. Anthony Duncan. Matthew Hoberman. Carly Nicole Putterman. Jacqueline Elizabeth Mahler. Matthew David Dorn. Tyler Utus Westfall. Dana Sung. Allison Emily Kuntz. Allison Alyssa Blackman. Melissa Celia Levin. Kristen Marie Bettner. Nolan Matthew Empeño. Michael Stephen Fialdal. Samet Kaliskan. Thierry Jean Farans. Sam Mataji. Isaias Alfredo Perez. Laura Ortiz. Morgan Hokuli. Maya Alexander Schwartz. Say it for me. Nikhil Patel. Brianna Patrice Prue. Anthony Lamb. Mustafa Almami Jawara. Emmanuel Awadou Sisse. Valerie Elaine Westney. Gabrielle Vargas Dico. Samantha Lynn Abernathy. Teresa Long. Ellie Patricia Turcott. Lindsay Heather Turcott. Jacqueline Louise Dale. Alana Jeanette Del Sordi. Emma Riley Wisted. Kelly Christine Flamond. Kelly Marie Dunn. Mackenzie Stewart Genthe. Ashley Sorego. Mizuki Takata. Kevin Liu. Jacob Lewis Boyer. Thank you. Kyron Brennan George. Jennifer Tova Neer. Luke Christian Verdi. Emily Sharston Shellman. Juliana O'Donnell Dawson. Eric Flores. Christina Louise Baton. Kahil Austria Rasul. Antonio Rafael Campanoshi. Michelle Lay. Kimberly Michelle Warren. Victoria Yamei No. Sanad Neighbor. Daniel Callow. Maria Jean Ayub. Gabriella Alter. Emily Ann Rolfing. Abigail Cahalan. Megan Elaine Doherty. Megan Bridie Costello. Lily Shore Bloom. Heather Ann Johnson. Maribeth Zankman. Catherine Joanne Walter. Catherine Mary Karamanica. Casey Kennedy Rogers. Kadar Mohammed. Jack Kenneth Clifford. Marshall Dupree. Shelley Chernin. Madison Disher. Lauren Ruth Batlas. Madeline Burns. Jennifer Marie Eckert. Alexa Bayovich. Evan John Scaparantos. Charles Ray Costello Christian. Michelle Briner. Maya Jillian Acosella. Rachel Norton. Becky Hannah Geller. Quinche Chernice Hall. Aziz Sanusi. Chance Anderson Albury. Ely Christopher Johns. Thomas Robert Glendenning. Cheney Manning. Molly Catherine Horan. Dana Nicole Harris. Andrew Tyler Brown. Jenna Rochelle Caraher. Brittany Alexis Buxton. James Hunter Templeton. Chase Matthew LaPalooza. Dawood Ahad Amiri. Daniel David Sutton. Camden Allen LaMarche. Shayna Aubrey Zaplitney. Robin Nicole Buxton. Catherine Elizabeth Johnson. Jasmine Wenda Nutonga. Kara Lanice Gaines. Lania Janae Lytle. Maris Drew Higginbotham. Casey Lee Gruber. Jamie Lee. Jacob Anthony Tribus. Andrew William John Pataco. Raimundo Antonio Carreon Chavez. Trevor Richardson. Madison Dale Nickens. Lorene Gill. Alexa Nicole Martini. Matthew Jacob Perry. Morgan Rose Aronson. Lauren Ray Davis. Sydney Hiller. Eric William Dewar. Alexander Joseph Leto. Evelyn Yame Nee. Amanda Jean Bettarello. Catherine Leah Waters. Miguel Sanchez. Alyssa Kuznetsova. Sema Nabil Boulos. Anton Mayer Eskander. Emily Josephine Gargiulo. Claudia D'Amico. Michael Eric Lober. Julia Blanche Serraro. Megan Rose Harrington. Brendy Lexi Moridian Elegbele. Brianna Curie Mallory. Alexis Simone Crispin. Grace Elizabeth Szynski. Fation Ismale. Christian D. Simon. Andrew Huang. Wan Kyung Oh. Brian Yaki Do. Kevin Mitchell O'Donoghue. Zachary Allen Robertson. Nicholas James Pulley. Rylan Keys. Jacqueline Sayakonmi. Tochi Ogudabuga. Michelle Obijakwu. Gregory Poku Dankwa. Moses Ogunoye. Abrielle B. Watts. Orion Henry. Thank you so much.
Great, what a job from everybody here. Congratulations to the Bachelor of Science degree recipients. So what a ceremony, and most importantly, we're actually on time, and that's critical. So this is really cool, isn't it? Because I know all you want to do is go out there and celebrate. So we're almost done. We're almost there. So congratulations to all the degree recipients from the School of Public Health. At this point, we'd like to recognize the bachelor's degree recipients who have earned Latin honors. The summa cum laude, the magna cum laude, and the cum laude are the highest commencement honors that the university confers for sustained excellence in scholarship. They are awarded to the top 10% of all students graduating in the School of Public Health over the course of a year. Summa cum laude is awarded to students with a GPA in the highest 2% of all college graduates. Magna cum laude to the next highest 3%, and cum laude to the next following 5%. Will those students graduating with Latin honors please stand? Way to go, gang, way to go. I know that all of the parents, the relatives, the friends who are here today to celebrate with all of you are so proud of your accomplishment, as are all your professors and instructors, and yes, the staff of the School of Public Health. Our concept here is we're a team. It's a team approach for us at the end of the day to have ceremonies like this, to be able to acknowledge your hard work as students, but also at the same time for me as dean to acknowledge the incredible work of our faculty and staff in order to get to where you are today. Your success also is attributable not just to the faculty and staff, but it's to the loved ones, those sitting in the stands here, and perhaps those who are here in spirit, who can't be here at this critical moment in your lives. We celebrate today along with those who have loved you, who have supported you, who have guided you, who have encouraged you. Your moms, your dads, your siblings, your aunts, your uncles, your grandparents, your mentors, your teachers, your friends. Now it's your turn to recognize them for all they have done to make it possible for you to be here today. Graduating students, please stand and give those people, those support structures, those teachers a round of applause. A key part of this moment is a reflection on this accomplishment for you and on future accomplishments for you. And that is that success in life, those accomplishments that we sometimes recognize through this pomp and circumstance, is never the result of an individual acting alone. Say your thank yous today. Be old-fashioned. Send a letter to somebody. Send an email. Recognize the people who made a difference for you to be here today. And now, ladies and gentlemen, and soon-to-be graduates of the School of Public Health, the moment you've all been waiting for. Sharing in an age-old tradition, will all of the School of Public Health degree candidates please rise, and would Sylvia join me here at the podium? Because it's going to happen right now. It's going to happen. Okay, grab that tassel, and on the count of 3, Sylvia's going to count it off, and on 3, you can't do it sooner. It's all got to be done as a team here, folks. On the count of 3, you go from the right to the left, signifying the beginning of a new era in your life. Sylvia, please, ready?
1, 2, 3.
Yeah! Congratulations, graduates. Okay, please be seated. At this time, I'd like to remind all of you to please join us for a reception in the School of Public Health, which is right next door, across the parking lot. All of our graduates should know how to get there. My hope. If you've been showing up to class, you should know where it is. There's another commencement ceremony here right after us, so we ask people, so for them to begin setting up, I ask the graduates and families and friends meet at the reception at the School of Public Health. I know it's a rainy day, it may not be the best day to linger outside, so come on in indoors. If you walk out the main doors of the Xfinity Center, the School of Public Health building is directly in front of you and slightly to the right across the small bridge at the end of the parking lot. We've also set up a photo spot in the Phrygian Family Student Lounge on the 2nd floor, complete with the School of Public Health banner. This is a nice location for those of you who want to take photos with graduates, family, friends, faculty, and staff. We'll also ask that as we close the ceremony, that the audience please remain seated while the platform party, faculty, and graduates exit during the recessional. So my final words to you, as we do this countdown to the end of this ceremony, is very simple. Remind yourselves of the path you're on. Remind yourselves that we're put on this planet to do good for others. Remind yourselves of what health is about, and that health is truly the complete physical, mental, and social well-being of our society, and not merely the absence of disease or infirmity. Remind yourselves what public health is about, and it's about promoting health and physical fitness. It's about preventing disease and injury, and it's about prolonging a high quality of life. You are now, as graduates of this famed institution, an institution that during your tenure celebrated its 10 years, and in essence are asked to go out and do good to the world. Take on the challenges that exist out there. There's no dearth of challenges for us to grab and to try to change the world, right? Is health equity a problem in our society? The answer is yes. Is health literacy a problem in our society? The answer is yes. Is physical fitness and lack of the body movement? Yes. Is the psychological components of our society a problem? Yes. Is the idea of behavioral and community health and how we connect with that community, is that a key component? Yes. Is health administration a key answer to solving our world problems? The answer is yes. Did I touch upon every single department here? The answer is yes. And that's what public health is all about. And let's not forget about the biggies. Let's not let's not ignore the ones that we oftentimes don't think about, right? Is opioid addiction a public health issue? Let me hear it loudly from the graduates out there. Can we do something about it? Is the issue of climate change a public health issue? Can we do something about it? Ladies and gentlemen, in this moment where once again we're mourning, is gun violence a public health issue? Can we do something about it? Graduates, I appeal to you. Change our world. Go out and do good. This concludes our ceremony. Let's go celebrate.